right, so we are at the Create Cures Foundation Clinic. We were founded by Dr. Valter Longo, and we are a team of registered dietitians and molecular biologists. We collaborate together to really provide effective and integrative strategies to support both cancer therapy as well as other conditions and work to optimize outcomes. Great. And yeah, we are some of the dietitians at Create Cures. So my name is Shayna Feinerman. I got my master's in nutrition, longevity, and health span. And I studied under Dr. Longo, and I did my capstone in cancer and vitamin D supplementation. So I'm really excited to talk about Dr. Longo's book, Fasting Cancer, today.
I'll go
Everyone.
next. Oh, sorry,
Go
Lotus.
ahead.
My name is Jordan Anthony. I am a registered dietitian. I as well got my master's from the USC Nutrition, Health Span, and Longevity program. And now that our chat box is working, I'm going to quickly highlight where we have people coming from. We have Florida, Houston. I saw Brazil in there, New York, Canada, Tennessee. So many people from so many places, and we are really excited to have you guys here. So I will pass it over to Loda to introduce herself.
Hi, thanks, Jordan. My name is Lota Andoni. I'm also a registered dietitian. I studied at the University of Southern California under Dr. Longo. And my research and my capstone was protein requirements on vegan and vegetarian diets.
Awesome. Okay, so before we begin, we're going to dive into the Fasting Cancer book today, but comment below who's read Fasting Cancer. I want to hear who's already heard some information about it. Let's see. We're getting some people listening to audiobook, reading Fasting Cancer. Awesome. So everyone has a good basis, and we're really going to go over a lot of the main points from the book and dive into some of the specific research that Dr. Longo mentioned in the book about each type of cancer. So we'll get into what we're going to talk about today.
Great. So just to go over our agenda for today. So we'll obviously talk about fasting cancer. We'll get into genes, aging, and how that impacts cancer. We'll talk about fasting, nutrition, and physical activity and prevention. And then Shayna and Loda will take over and talk about fasting, nutrition, and different types of cancer. Tonight, we're going to dive into breast, colorectal, and brain cancer. And just a little disclaimer for everyone. So this presentation will be exploring Dr. Longo's research on lifestyle, particularly nutrition, fasting, and physical activity, and how it may support cancer treatment. Really important to note here that any kind of fasting mimicking diet, it's not a replacement for conventional cancer therapies, but may help to optimize its effectiveness when done under medical supervision. We are not providing any sort of medical advice tonight. And as always, please consult with your oncologist or care team before making any changes to your treatment or diet. We will be answering some questions at the end of our presentation, but again, we are not able to give any personal medical advice tonight. If you have personal questions about your situation, please reach out to the Create Cures Foundation. We'll give you the email at the end of the presentation, and you can contact our office to schedule an appointment. Great, so let's dive into understanding cancer and the cell confusion. So cancer cells thrive on nutrients. So unlike normal cells, cancer cells are greedy. They rely on constant high supply of sugar, proteins, and fats, which helps them or makes them keep multiplying. Normal cells can pause during fasting, so healthy cells know how to slow down and protect themselves when food is scarce. So let's dive into how fasting works. So during fasting, healthy cells activate protective pathways, but cancer cells cannot. So they continue to grow, making them more vulnerable to treatments like chemo. I like to tell people, think of this as a battlefield. So imagine healthy cells are kneeling behind shields while cancer cells are exposed, and chemotherapy then hits only the cancer cells harder. And I think a lot of the times when people hear the word fasting, they think you're starving, you're not eating any food, but that is not the case. Brief medically graded fast or fasting mimicking diets can create this same protective magic shield without harming the patient and without totally going into a starvation state. So let's dive into what the research shows. So there's been mouse studies that have shown that the mice who were fasted before chemo were significantly more likely to survive with fewer side effects versus those who ate normally, they had higher death rates. Some cancer patients using fasting cycles with chemo have reported better tolerance and energy. And early clinical trials show some great promise. As we mentioned at the beginning, please always consult with your doctor, with your oncologist before you do any of these types of things. Fasting can cause a lot of stress in the body, and the goal is to use it strategically, always under medical supervision. This is a very personalized approach. Each individual is different, which is why it's so important for us to meet with patients one-on-one versus giving general medical advice or diet advice. So cancer is considered a disease of aging. So as we age, more DNA damage occurs in our body. Over time, our cells accumulate mutation, especially in genes that control cell growth. So there's something called an oncogene, which is a growth promoting gene. And when those are stuck on and the protective genes are damaged, cancer can emerge. And the older we get, unfortunately, the greater risk for developing cancer is at play here because mutations accumulate and immune function declines. So we'll get into kind of the shared pathways in terms of aging and cancer. So IGF-1 is a hormone, mTOR is a protein, and then something called RAS is a group of proteins. These genes promote growth, which is good in youth, but can be dangerous in aging. So if we can turn these genes down, we can live longer and we can have less incident of cancer. Studies in animals shown that reducing activities in these pathways can extend lifespan and reduce tumors. And fasting mimicking like diets naturally suppress these aging accelerators, which helps create a more balanced, protective internal environment. So how can we slow the clock to prevent cancer? The good news is there's ways to do so. Important to note that we need to focus on health span, not just lifespan. So it's not necessarily about living longer, but it's about staying healthier longer. So certain lifestyle shifts can have long-term protection. So obviously diet, fasting cycles, and exercise have been shown to slow biological aging and reduce conditions in which cancer thrives. And then there's a theory that we want to kind of put into play here. It's called juventology, which is the science of staying youthful. It has a lot of data that's backed, and it starts with what you eat and how you live. So the food we're putting into our body really does make a difference. And if we eat a well-balanced diet, there's lots of research showing that it can be preventative. So I'm sure all of you, or hopefully most of you, have heard of the longevity diet. So this type of diet is mostly plant-based, low protein, and high in healthy fats. So think lots of leafy green vegetables, lots of different colors of vegetables, leaning towards more plant-based kinds of proteins, legumes, beans, focusing on healthy fats like olive oil, nuts, avocados, with having occasional fish in there as well. We really want to minimize red and processed meats and sugars. So bacon and lunch meat and steak and all of these meats have been shown there's a correlation with increased risk of inflammation and increased risk of cancer. And then another big pillar of the longevity diet is to eat in something called a time restricted window. So a 12 to 14 hour overnight fast may reduce metabolic stress in the body and help with cell regeneration. So I always tell people, if you eat dinner, try to eat dinner around 6 or 7 p.m. while it's still light outside. And then when it's dark, we really want to give our bodies time to rest and digest overnight. Give yourself the overnight 12 to 14 hour window and then resume eating at 7 or 8 a.m. in the morning. So quick question for you guys to see who's here, who's paying attention. So true or false, eating red meat on a regular basis is part of the longevity diet? False, false. Okay, good. Great, everyone. Amazing. We can go to the next slide, please. So let's talk about the fasting mimicking diet for prevention. So what is the FMD? It is a 5-day diet that is low in protein and sugar and high in healthy fats that simulates fasting without full food deprivation. So one of the main pillars here focuses on that it triggers something called autophagy, which is cell regeneration, self-cleaning of our cells. It really encourages the body to recycle damaged cells and helps reduce inflammation. It can be done 2 to 4 times a year. Clinical studies suggest that the FMD may lower risk of factors like cancer, diabetes, and heart disease when done periodically. As mentioned, if you have an oncologist or a primary care doctor, please consult with them first before deciding to do the fasting mimicking diet. But lots of robust research showing the benefits of the fasting mimicking diet. And lastly, for me, obviously diet is incredibly important, but also movement is equally important. So the more we move, the longer we're going to live. So regular movement can reduce cancer risk. Lots of research studies have shown that physical activity can reduce rates of things like breast, colon, lung, and other cancers. Exercise also boosts our immunity, helps reduce inflammation, and really strengthens our immune surveillance. In terms of guidelines, aim to get about 150 minutes a week of moderate activity or 75 minutes a week of vigorous exercise. So do what works for you, whether it be swimming, hiking, biking, taking a workout class. Just try to move your body as much as you can. Go on walks during the day. Try to get up from your computer, every 30 minutes or so, just to really keep your body moving. Great. I will turn it over to Shayna, who will get into fasting and specific types of cancer.
Great. Thank you, Jordan. So first off, we're going to talk about colorectal cancer. So another quiz question for you guys. And by the way, I hope everybody's paying attention because there's going to be a summary quiz at the end. But for this time, colorectal cancer, true or false, is the third most common and one of the most lethal cancers in the world. So comment, true or false. Let's see. And it's true. It is true. It is a very common cancer and it can be lethal. But let's get into it because luckily there's a lot of great news about fasting if you do have colorectal cancer. So let's go into it. All right, so just an overview. There were 1.8 million cases of colorectal cancers reported in 2018. And our colon is 5 feet long. We're eating 3 times a day. There's a lot of activity going on in there that can make what we really critical in this type of cancer. So in most cases, this cancer begins as these polyps in the colon or rectum. This is why it's really critical to have early detection because these polyps can be removed surgically. However, if it gets to a more advanced stage, we might use, or you might get a combination of surgery, chemo, and targeted therapies. So some common treatments include different types of chemotherapies, biologic agents, and then if it's stage 2 and beyond, it's usually a combination of both of these. So let's introduce something called the Warburg effect, which many of you might not realize you've probably already heard of. So the Warburg effect, this is originating back in 1923. This is referring to the observation that most cancer cells produce a large amount of lactate from glucose, and even in the presence of a lot of oxygen, they use this. So unlike normal cells, we might use oxidative phosphorylation to generate energy when oxygen is available. So this is suggesting that the aerobic glycolysis allows cancer cells to grow more rapidly and resist stress. So colorectal cancers, like many other types, use this strategy to fuel tumor growth. So what does this mean? This means, and we've probably all heard like sugar feeds cancer. But as we'll talk about, it's a bit more complicated than that. So what is this strategy and how does fasting play into this? Well, fasting is actually lowering our blood glucose, so this forces cancer cells to then reverse that Warburg effect and use their mitochondria to generate energy. However, and Dr. Longo says sometimes, cancer cells are dumb and they have damaged mitochondria, so they can't always generate energy this way effectively. So as a result, our fasting and our treatment then pushes the cancer cells into this metabolic crisis. They don't know what to do, they don't know how to make energy. This leads to a surge in free radicals, which are these toxic molecules that damage the DNA and the proteins. And then this triggers cancer cells to go and undergo apoptosis, which is cell death. So as a summary, this fasting strategy, it's not replacing our treatment, but it can enhance the effectiveness by exploiting the weakness of the cancer cells and their energy sources. So let's talk about the research. So there was a study that Dr. Longo talks about in the book. This is a 2010 study. It tested fasting and doxorubicin, which is a type of chemotherapy, versus chemotherapy alone in cancer cell or colon cancer cells. So what's the result? They had no significant difference in cancer cell death. So fasting alone wasn't enough. However, they retested this again and then concluded that the combination of fasting and chemo then triggered greater cancer cell stress and damage. So the fasting, again, like we talked about, enhanced the cell stress, it increased those production of those toxic molecules, and then further made those cancer cells self-kill themselves. Great. And then this study, so in different types of chemos or different treatment plans, you might also get a kinase inhibitor. And so this study showed that fasting also works in kinase inhibitors. So it makes it more effective, indicating that it can help with other drugs besides just chemo. So again, we're using fasting, and what the studies really show is that with just fasting alone, it doesn't really help as much, but the combination of fasting and the treatment is really what is making it more effective, rather than even just the treatment by itself. And now, many of my patients, a lot of people ask, okay, have you heard about vitamin C? Vitamin C is going everywhere. It's this magic drug. But what does it really mean and where has it been found to be most helpful? So this idea of vitamin C and helping kill cancer cells has actually been around for a while too. And it's really good to note that a lot of the research that we know about now, or the groundbreaking studies now, have been around for many years, and they should be because we're testing them. So back in the 1970s, Linus Pauling was one of the first to suggest that a high vitamin C dose could help treat cancer as well. And then in Dr. Longo's studies, back in 2015, there was this groundbreaking mouse study that looked at these preclinical models of this KRAS mutant colorectal, pancreatic, and lung cancer cell lines. So all you should know is that this is a specific mutation found in these specific cancer cells. And it showed that vitamin C could specifically slow the growth of these mutant cells in colorectal cancers. So this activates the RAS pathway, which is a key driver of cancer cell proliferation. And then we looked again in 2020 on the vitamin C high dose and the fasting mimicking diet, and we found that across these specific KRAS cancers, in specific those mutations, vitamin C had a modest effect at helping kill the cancer cells, and you can see in this table on the right. But in combination with the fasting mimicking diet, I mean, this was like a 20-fold increase in the effectiveness. So indicating that, again, fasting mimicking diet is great in combination with both the treatment and potentially vitamin C. But how does vitamin C really work? How is it actually killing cancer cells? Should we all be taking vitamin C? Well, vitamin C, and this is specific, it's very, very high doses. It increases ferritin, which is an iron storage protein in these specific mutant cancer cells. So when vitamin C and iron interact, they generate, again, free radicals, those toxic molecules. And in cancer cells, this leads to oxidative stress, mitochondrial damage, and then cell death. And FMD further enhances this effect by weakening cancer cells' stress defenses and amplifying the oxidative burst, creating a powerful synergy. And I think it's also important to remember too that the FMD, like Jordan was talking about, induces this sort of awareness in the body of what's a normal cell, what's a cancer cell or abnormal cell, and helps, again, increase the effectiveness and protect your healthy cells. So that's also why we see these great effects in combination. And when we think about the colon, we got to talk about the gut and the gut microbiota. So there are many, many studies that link colorectal cancer to gut dysbiosis. So this is a decrease in the beneficial bacteria in your gut. We have over 70% of our immune system lies in the gut, and these bacteria are really deep in code with our immune system. So it's really important to help prevent dysbiosis, and we can do that with a plant or pescatarian diet. So the things that really fuel our gut bacteria and promote good gut bacteria are fiber, polyunsaturated fatty acids, polyphenols, and probiotics. And there is about 1 million studies to suggest and prove that diets that are rich in these items may improve also responses to treatment and reduce inflammation. And we see this at the clinic. A lot of our patients who tend to follow the longevity diet during their treatment, they tend to reduce their side effects and improve their outcomes as well. So a really interesting study in Nature 2015 showed in 40 patients a high fiber diet increased microbial diversity and lowered markers of cell proliferation and inflammation. So again, diets rich in vegetables, fruits, and whole grains are associated with a very high reduction in mortality and higher 5-year survival rates, especially in colon cancer. So as a summary about colon cancer and the treatment, again, talk to your doctor and definitely follow the standard cancer therapy, but we can see about combining with the FMD. And as long as that's safe for you, maybe talk to your oncologist about following high-dose vitamin C if you have the KRAS mutation. Follow the longevity diet to help support your good bacteria in your gut. Like Jordan mentioned too, an overnight fast is really important to get that cellular regeneration every night. Maintain good body weight and be active and exercise. And then I'm going to pass it over to Loda.
Thanks, Shayna. That was so interesting. So next we're going to talk about breast cancer, and I'll start with another true or false question. So comment in the chat box, true or false, breast cancer is only found in women, not in men. Right, I'm seeing some very fast answers. So far, everybody is correct. It is false. We actually do see breast cancer in men as well. And it's estimated that in 2025, this year, over 2,800 men will be diagnosed with invasive breast cancer in the United States alone. So first, a little overview of breast cancer. It is the most commonly diagnosed cancer in women. 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime. And this year, it will be an estimated 375,000 new cases in the US alone. It's the second leading cause of cancer death in women, but if it's caught early, there's a 99% 5-year relative survival rate. The average age of diagnosis is 62 years old, but 9% of new cases are diagnosed in women under the age of 45, and it's increasing in prevalence. Some risk factors for breast cancer are increasing age, a family history of breast cancer, genetic mutations such as BRCA and BRCA2, which you may have heard of before, and exposure to estrogen, including like early onset puberty. There are a few different types of breast cancer. The first type is hormone receptor positive breast cancer. These are where cancer cells have either the estrogen receptor, the progesterone receptor, or both, and those are two hormones. This type of cancer is most commonly treated with hormone therapy to block the action of hormones on the cancer cells. The next type of breast cancer is human epidermal growth factor receptor 2, or HER2 positive cancer. And these cancer cells contain a receptor that's activated in response to this epidermal growth factor. These cancers can be either hormone receptor positive or hormone receptor negative. And these cancers are commonly treated with drugs that target HER2 and in combination with chemotherapy, or if indicated, hormone therapy if it's hormone receptor positive. The last type of breast cancer is what's called triple negative breast cancer. This is the most aggressive form of breast cancer. It's where the cancer cells lack both hormone receptors and the HER2 receptor. These cancers are most commonly treated with surgery and chemotherapy, and occasionally also immunotherapy and chemotherapy. And just a note, because we will be talking a little bit about stages of cancer, there are 4 different stages, or 0 to 4 different stages. So stage 0 is precancerous, where abnormal cells are present but have not spread. We may be doing some more active surveillance at that point. Stage 1 is early, where the cancer is small and hasn't spread beyond the organ it started in. Stage 2 is where the tumor has grown and may have spread to nearby lymph nodes. Stage 3 is a larger cancer, which may have spread to nearby lymph nodes or the tissue or formed multiple tumors. And stage 4 is what we would call advanced or metastatic cancer, where the cancer has actually spread to other parts of the body through the bloodstream or the lymphatic system. So breast cancer is the most studied type of cancer in combination with fasting-mimicking diets. We see that fasting-mimicking diets are effective as a support for traditional therapies, especially in the later stages of cancer. So as we've been talking about before, we're not suggesting that it's a replacement for traditional therapy, but it can make the traditional therapies more effective and potentially reduce the side effects. And we see lots of both preclinical data in mouse models and then also human trials showing this combination of cancer drugs and fasting-mimicking diets, improving survival rates and reducing those side effects of treatment. And this is in part due to triggering these widespread changes that we've been mentioning before, where we sensitize the cancer cells to treatment. So it's causing this differential stress sensitization and increasing the protection of normal cells with this differential stress resistance, where they know to put up those shields, but the cancer cells don't know how to do that. And this can also be helpful because cancer cells can eventually become resistant to certain drugs used against them. So anything that we can do to prevent that from happening is going to be beneficial. And this is just a little chart showing the difference between how normal cells respond to fasting and how the cancer or malignant cells respond, where their oncogenes are always turned on, and so they just don't know how to respond, how to deal with the fasted state. So I'm going to go into a couple of different trials that are mentioned in the book. The first is a study on fasting and chemotherapy, where it showed that 2 fasting cycles plus chemotherapy are more effective than chemotherapy alone in these aggressive triple negative breast cancer cells in mice. So the chart on the side of the screen shows where chemotherapy alone, all of the mice had died within 12 days for toxicity of the treatment. What's really interesting is that both fasting alone and no treatment led to rapid cancer cell growth. So this is a little bit counterintuitive because we're promoting how beneficial fasting is, but this is likely due to the very important period right after fasting, which is called the refeeding period. And during refeeding, that's where there could be some reactivation of cancer stem cells, which could increase proliferation, or there could have been, if the refeeding wasn't with like this low protein, more plant-based diet, exposure to certain mutagens like charred foods or a large amount of amino acids that could also promote cancer cell growth. So it's really important to combine the fasting with the treatment. And that's in the chart in the graph that shows the fasting and chemotherapy. The tumor growth was delayed and the mice experienced reduced toxicity, which led to longer-term survival. There's a dramatic difference between the fasting, the no treatment, and then the chemotherapy only. And then this is a trial that was in human subjects, a clinical trial in advanced stage triple negative breast cancer patients. They were receiving either chemotherapy alone or the chemotherapy plus FMD, or the fasting mimicking diet. And in this trial, we showed that compared to chemotherapy alone, the patients undergoing the cycles of the FMD survived nearly twice as long on average, so over 30 months. And the portion of patients surviving at 40 months was over twice as high. So pretty significant increase in survival rates. Another form of treatment that is not used very often is immunotherapy. It doesn't have very much effectiveness on breast cancer. It tends to be a little bit more expensive and it can have some major side effects. But one thing that we've seen is the fasting mimicking diet can help activate immune cells in mice undergoing chemotherapy, and that can help the immune cells attack and neutralize the cancer cells. So in theory, this might be able to enhance the efficacy of immunotherapy. And we have seen that combining two immunotherapy drugs with the fasting mimicking diet was more effective than immunotherapy alone when tested in mice who had triple negative breast cancer. And the chart shows how the immune cells can actually infiltrate the tumor. And we also have some research on fasting and hormone therapy. So around 75% of breast cancers proliferate or expand in part due to hormones, and it's primarily estrogen that's driving that. We have seen that cancer cells can become resistant to some of the hormone blocking therapies out there. And we also know that insulin, glucose, leptin, and IGF-1 promote cell growth and can lead to cancer cell resistance to the hormone therapy. So fasting mimicking diets actually reduce these factors, all of them, and can delay hormone-dependent growth. So this may help prevent cells from becoming resistant to the hormone therapy and reverse cancer growth in mice. And that's what this experiment is showing. This CAFA trial showing that the hormonal therapy with palbociclib, it blocks breast cancer growth for several months in mice, but in the long term, they become resistant to the therapy and start to grow again. But when you add the fasting mimicking diet to the treatment, the combination stops cancer from becoming resistant to the drugs, and it can help prevent the cancer cells from growing. One other thing to note in there is you can again see that both the no treatment and the fasting mimicking diet alone were not sufficient. The tumors grew in size with either of those interventions or no treatment. So one thing that is mentioned in the book is this wild card effect of fasting. So what does that mean? Well, most treatments like immunotherapy or hormone therapy, they have very specific cellular targets and they only work against certain tumors or certain cancer cells. But as we mentioned, fasting can lower cells of many factors systemically throughout the body. So IGF-1, insulin, glucose, leptin, and cancer cells work using these factors to grow and survive. Cancer cells can be dependent on just one of these factors or all of these factors, or they can also mutate. So it could start by being affected by insulin and then mutate to be affected by leptin. But fasting reduces all of these factors at the same time. So it can reduce the number of escape pathways that are available to these cancer cells. And then that can lead to sensitizing them to the appropriate drugs. And the graphs on the side of the screen show how fasting mimicking diet can increase ketone bodies, it can decrease glucose, decrease insulin, and decrease IGF-1. So in summary, again, always work with your oncologist to use the standard cancer therapies that are indicated. Talk to your oncologist about combining the standard therapy with the FMD, or the fasting mimicking diet. Between treatments, it's really beneficial to follow a healthy lifestyle, such as the longevity diet. following time-restricted eating, as Jordan mentioned, for 12 to 14 hours a day, maintaining normal body weight, monitoring muscle mass to make sure it doesn't get too low because of that immune function of muscle, being physically active and strength training 3 to 4 times a week for 30 to 40 minutes to help maintain that muscle mass. And if the above isn't enough, you may want to talk to your oncologist and nutritionist to alternate the fasting mimicking diet with a low protein, plant and fish based keto diet, which Shayna will actually talk about in a little bit. So quiz to see if anybody was picking up on what the wild card effect of fasting is. Comment in the chat box. Does anybody remember how to describe the wild card? All right, well, the wild card effect was that ability to decrease multiple factors systemically. Yes, great. I see decreased levels of insulin, glucose, leptin, and IGF-1. Perfect. And that targets many, many pathways. All right, so we've gone through a lot. So let's just take 4 deep breaths before continuing, and then Shayna will cover the last type of cancer that we're discussing today.
All right. Hopefully everyone can take a few breaths. We definitely need it to talk about brain cancer because there's a lot more research to be discussed. But let's try to simplify it. So before we begin about brain cancer, quick question, true or false? Does brain cancer spread to other parts of the body? So true or false? It rarely spreads to other parts of the body. Comment below. What do you guys think? People are saying false, and actually it's true. It rarely spreads to other parts of the body. So usually if it originates in the brain, it will rarely spread. So let's get into it. All right, so brain cancer, it affects about 30 of every 100,000 people each year. The specific type, which is most common, is called gliomas. They're making up about 78% of the malignant brain tumors. There's a bunch of other types, such as ependiomas, neuroblastomas, oligodendrogliomas. The most aggressive form is glioblastoma, which is a stage 4 glioma. So diagnosis usually begins with a CT scan or MRI, and then when possible, we try to remove the tumor, but also additional treatments might include chemo, radiation, and either before or after surgery. So the idea again, as you've seen before, is the fasting mimicking diet has been shown to be helpful in combination with treatments. So when a patient is able to do one of these, it might be indicated. So when we're also thinking about how can we optimize the cancer treatment and make it more effective, we want to think about how the cancer is working, right? So there's these conventional hallmarks of cancer. So these are thought to be the increased growth, inducing angiogenesis, which is the formation of blood vessels, and metastasis, so spreading to other parts of the body. However, there's been more studied characteristics of cancer, which are genome instability, so the tendency for DNA and other genetic changes during cell division, inflammation, which we hear about a lot, and then also reprogramming of the energy metabolism of the tumor cells and the tumor microenvironment, kind of like the Warburg effect. So going into neuroblastoma. So this is a very aggressive cancer. It's usually diagnosed in young children. So studies in the FMD, let's talk about it. So in 2012, this study showed, and this is the top right, 100% of the mice with neuroblastoma died after 70 days, despite the treatment with a potent toxic chemo. So on the other hand, the mice treated with the combination of the same chemo and fasting had a 25% survival at 1 year. So at that point, they were likely cured. In a different experiment with a different type of neuroblastoma, this effect increased even. So the mice that were treated with a combination of fasting and chemo had a 42% survival, whereas the control group, which didn't have anything, had 100% mortality. Great. And then, so for glioblastoma, like I said, this is a very, very aggressive brain tumor in adults with a very short survival. And in 2011, one of Dr. Longo's labs tested the benefits of fasting in combination with temozolomide, which is a treatment common for this type of cancer with glioblastoma. So what they found was that the TMZ, the treatment, was significantly more effective in killing 5 different glioblastoma cancers from both humans and mice, which is really incredible. And it appeared to protect the normal cells while sensitizing the glioblastoma cells to the treatment. Really incredible study. And then, yeah, looking more into it, the fasting made the chemo more effective against the cancer cells. And after just 1 month, 80% of the mice were alive against the 40% that just had the chemo alone. So 2 times survived, which is really, really important to know. And I know that when we talked about the Warburg effect and taking out sugar and reducing sugar for cancer cells, I'm sure one of you were thinking about, okay, what if we do the keto diet? What if we basically have no carbs and no sugar? And what's that going to do? Well, it's more complicated than that. So the ketogenic diet is a low carb diet. It's a daily diet that has a normal amount of calories. And did you guys know that the keto diet was originally used for epilepsy? Well, this kind of tells us something in the brain is working with the keto diet. So the keto diet works better in brain cancer compared to other types of cancers because brain tumor cells are especially dependent on glucose and have a limited ability to use ketone bodies for energy, while normal brain cells can actually efficiently switch into ketone metabolism. So how this suggests that long term too, like, or we have heard research too and seen it that potentially long term those cancer cells and other types of cancer cells might be able to adapt to using ketones. So usually in our clinic, we might only recommend a keto diet for a short period of time. And also in this chart, you'll see that actually the fasting mimicking diet is somewhat of a keto short-term diet. Obviously, compared to the keto diet, it's low in calories. It's still lower in carbs, very low in protein too. So you're essentially putting yourself in using those ketones for a short amount of time. So we usually don't recommend keto diet for that long, but there's research to suggest that in brain cancer, it's more effective. It's also important to note that per Dr. Longo's research on IGF-1, a lot of traditional keto diets are usually high in protein, high in animal protein especially, which can potentially also accelerate cancer progression. So it's better to have more of a plant-based or pescatarian keto approach, which should be assisted by a dietitian or oncologist as well. So what did the studies show for brain cancers? So specifically glioblastoma, again, looking at this type of cancer. In Germany, they tested a combination of keto with water-only fasting and found that in patients either receiving radiation and healthy diet or radiation plus keto and water fasting, after 6 months, 20% of the patients on the fasting keto diet combined with radiation had not progressed in their cancer versus only 16% in those with radiation only. So more studies need to be done to understand the effect, but also they did find a lot of, like Loda was saying, there's a lot of other effects that happen when you're doing the fasting mimicking diet or fasting. So they had lower blood glucose levels and their cancer grew slowly, survived longer. So in summary, for brain cancer, again, talk to your doctor if you are interested in combining it with the fasting mimicking diet, always using standard cancer therapy. Talk to your oncologist and nutritionist in order to combine it potentially with a keto diet that's more plant-based evidence-based. Also following your cycling with a longevity diet, fasting overnight, again, body weight, physically active and exercising, as it's effective in all types of cancers. So what are the main points we've talked about today? So we're always looking at optimizing longevity diet because, again, this is our everyday diet that is shown to be protective against cancer. And if you have cancer, doing the FMD if it's appropriate. We talked a lot about in cases where it is appropriate. However, there are a lot of cases where it's not. So it's important to reach out to us, schedule a consultation, and we can go through that with you based on all the research. We talked about optimizing lifestyle factors too, exercise, sleep, and stress. And then it's important also, if you have cancer, if you don't have cancer, monitor your body composition, your intake, and then your blood markers as well. And then we also talked about longevity diet. If you're interested in learning more, Dr. Longo also has a book about this, and it includes, talking about that daily diet with a lot of plant proteins, vegetables, lower in protein, and avoiding some processed foods, animal products, or high protein foods.
Great. Thank you, Shayna. So we have some questions that were put in the chat that we will answer after a short quiz. So let's dive into a few questions and then we will. Oh, everyone's already answering. Before we get started on the question, I see a lot of people asking if this presentation will be archived. If you go to our YouTube channel, there's a link at the end, but it's at Create Cures Foundation. All of the webinars will be there so you can replay it later. Okay, so first question, can the fasting mimicking diet replace standard cancer treatment? It looks like everyone is saying no. Good job, good job. Okay, next question for you guys. What is the most studied cancer in combination with the FMD? We have colon, we have breast cancer, colorectal, breast. So the correct answer here is breast cancer. In terms of most studied combination with the FMD, breast cancer is the most studied. And then final question for you guys before we jump into some questions. So this is an open forum. What is the most interesting thing you learned either from our presentation or reading the Fasting Cancer book? Type your answers in below. I can read out a few. The vitamin C, people thought that was very interesting. It seems like a lot of people are saying incorporating vitamin C with fasting, the low protein diet, using keto diets for brain cancer. Yes, these are all incredibly interesting. Good job, everyone. Fun to hear your responses. Okay, so next slide, and then we'll dive into some questions. If you guys have questions, you want to meet with one of the dietitians on our team, you can email us at clinic@createcures.org. As I mentioned, please subscribe to our YouTube channel to get notifications about our upcoming webinars. You'll see past webinars on there that you can listen to. So I'll dive into a few questions right off the bat, which I can answer. Somebody said, I don't understand the low protein part of the fasting mimicking diet. I see so much information about increasing protein, especially after age of 60. So why low protein? And this is a very, very good question. We get this a lot. As I had mentioned, there is a growth hormone called IGF-1 that promotes cell growth. But this hormone has been shown to have impacts higher risk of cancer, particularly as we age. And eating animal products like meat and processed meat is what rises IGF-1. And lower protein intake or eating plant-based sources of protein is how you keep your IGF-1 levels in that optimal range. Obviously, protein intake varies based on age and activity level and health status. So consult with a dietitian to see how much protein you should be eating. But I think the bigger theme here is to avoid excess intake of animal protein, really focus on plant-based sources of protein. So beans and lentils, and really try to get as many vegetables as you can in your diet.
I think
Okay.
one thing to add there is the question about the low protein within the FMD, if I read that correctly. So the reason for low protein during the fasting mimicking diet is to avoid triggering some of the nutrient sensing pathways. And then we also do change our recommendations depending on whether somebody's over the age of 65 or showing any signs of anabolic resistance or inability to build muscle mass.
Next question, I think Shayna, you spoke about this, so maybe you can answer this. Somebody says, for the high dose vitamin C, do you mean an IV infusion or an oral/liposomal intake of vitamin C?
Great questions. Yeah, by high dose vitamin C, we're talking about IV vitamin C. So it's usually done in an IV at a high dose. Usually it's equivalent in grams to your body weight, but that varies. Definitely talk to your doctor, have a doctor administer it because there are a lot of clinics out there that do it, but if you have cancer, it's very important that you talk to your doctor about starting to do it. I saw a question about what's an efficient way for a cancer patient to share Dr. Longo's research with their medical care team. And breaching that subject with your doctor is really important. So Dr. Longo's research is available online, and you can, if you have your specific cancer, you can usually look up your cancer in relation to what research has been done. I would share that with your doctor and discuss with him. And like a lot of people have commented too, understanding the timing with if you're integrating the FMD is very important. So highly urge you to reach out to us because this is what we do. We collaborate with Dr. Longo in determining the specific timing appropriate for each individual patient based on their treatment type. So it's very important to be able to talk to us, but also talk to your doctor and follow what the research is saying.
Great. I saw another question. Can the FMD be used for each round of chemo rather than 2 to 4 times per year?
So it's very dependent, right? So there has been studies that show in our practice, people might integrate the FMD multiple times, more than 2 to 4 times. However, you cannot do the FMD. It's very important to not do it more than once a month. But again, it should be timed specific with your treatment.
And then another question I'm seeing, if we want to reduce protein, especially animal protein, why does the longevity diet recommend eating fish several times per week?
Great question. Loda, do you want to answer this one?
Yeah, sure. So that's for some of the beneficial compounds that we see in fish, especially fatty fish like those omega-3 fats. And in fish, they're in the DHA and EPA form, which is different than the plant-based versions of fats. So that's one of the benefits of including fish. Although if somebody does want to be plant-based, they can take algae oil supplements to get some of those DHA and DHA and EPA omega-3s. But we do see a lot of benefits for fish as complete sources of very biologically available protein and those omega-3s.
Also worth noting here, fish doesn't raise your IGF-1 levels as much as red meat and processed meat, which is why, lots of benefits with the omega-3s, good for your brain health, but also because it doesn't have such a big impact on your IGF-1 compared to red meat. Okay, I think we are out of time for questions. I see a lot of personal questions here about your specific situation, your condition. As mentioned, please reach out to the clinic. You can find the email on this slide, clinic@createcures.org if you want to meet with one of our dietitians, if you would like to schedule a consultation with us where we can really dive into your specific situation and make super personalized recommendations for you. If there's any other questions, please feel free to reach out. It was really great to meet you all, and thank you for joining us today. Thank you.
Thank you, everybody.
Have a good night.
Thank you.